going to be starting taking your vital signs. Can you just go ahead and confirm your last name and date of birth for me, please?
Sure. My last name is Johnson.
Okay.
And my birthday is March 2nd of 1999.
Okay. Have you been having any symptoms lately that brought you here today?
Yeah, I've noticed more like in the mornings and afternoons I've been having like pins and needles in my fingertips and my feet, and it's mostly on my right side, I've noticed.
Okay, so you say mostly in the morning and night?
And afternoon.
Okay,
yeah.
And mostly on your right side? Okay. Just going to start inflating. When did you notice it starting?
Within the last month.
So right side. Did you notice anything changing in your routine? Did something happen? Did you get injured or something like that?
No, I'm trying to think. I guess I did fall when I was roller skating.
Okay.
Within the last month too, and I didn't think that would affect my hands and feet, but maybe it did.
Okay. When you fell, where did you hit?
I fell on my shoulder.
Okay.
Yeah. And my right shoulder.
Any back pain that you've been experiencing?
Not back pain, but like upper neck pain.
Okay. And does that pain feel like muscular, like when you kind of like sleep in a weird position?
Yeah.
Okay. And that pain has been going on since you fell?
Yeah.
Okay. And this was about a month ago? Okay. Okay. 98 degrees. Your blood pressure was 110/77, so that's pretty normal. Just gonna slide this right here. You can go ahead and rest. Okay, I'm just gonna ask you a couple other questions about your medical history. Have you had any spinal cord injuries in the past?
No.
Okay. Any major surgeries?
No, I did not.
Okay. Any family history of high blood pressure, diabetes?
Yes, my uncle on my mother's side had
Blood
diabetes.
pressure.
Yeah.
Oh, diabetes. Thyroid?
Yes, on my mom's side too.
Okay. Do you smoke?
No, I do not.
Do you take recreational drugs?
Mm-mm.
Do you take medication regularly?
Yes, I do.
Is it, what is it for?
Birth control, and then to help with my acne.
Okay. Okay. Any known allergies to either food or medicine?
Peanuts, yeah.
Okay. And do you consume alcohol?
Yeah, but on a rare occasion.
Okay. How many drinks a month would you say?
Probably like 5.
Okay. Okay. So, now take this out. So that's 70 beats per minute. It's normal. And 97% oxygen room here. Okay, so I have this patient gown I want you to change into.
Okay.
You can leave the opening in the back, okay?
Okay, sure. Thank you, doctor.
So we're going to start doing some tests. We're going to be doing some tests on both, all 4 of your extremities, arms, and legs. And we'll be checking your back and your face as well. So first I'm just going to be checking your lymph nodes. Okay, so I'm going to be checking your lymph nodes. Just going to go ahead and try to keep your hair on the back. I'm going to start palpating. And I'm looking at your pre-auricular and post-auricular lymph nodes first. Don't really notice any swelling. I do notice a little bit of irritation along your jaw. Have you noticed that the medication you're taking is working?
For my acne?
Yeah.
It has. It's mostly just scars now.
Okay.
No more bumps, so it looked worse before.
No, it really is not bad. But was this all of a sudden, or do you have history of acne?
I actually got off my birth control for a little bit, just to have like a little cleanse, and this was the result of it. It was horrible hormonal acne.
Yeah, that's what I was gonna say, that it's definitely hormonal, just because of the placement of it. It's right by the chin, and it's usually the most affected area.
Yeah.
Okay, go ahead and turn your head to your left. Just gonna palpate. I'm gonna open the first button of the gown here just to look at the lymph nodes by the clavicle. I don't notice any swelling, so that's great. Yes. Okay, go ahead and turn to your right. Again, I'm just going to open the first button here. No swelling either. Okay, go ahead and just try to shrug your shoulders and hope. Sometimes this movement makes the lymph nodes, if they're swollen, it makes them palpable, but yeah, I don't notice anything out of the ordinary. Okay. Just gonna put this back up. Go ahead and palpate your sinuses. Okay. I really notice a lot of inflammation in the face. Sometimes with hormonal imbalances, it can cause puffiness. Did you notice anything like that or not really?
Maybe a little bit in that like cheek area, some puffiness.
Yeah. And as soon as you went back into taking the birth control, it all went away, all those symptoms?
No, it took maybe like 2 to 3 months for it to calm back down.
Okay.
So for 2 to 3 months, had horrible acne.
Yeah.
Okay. Maybe even longer than that.
Yeah, it really doesn't look too bad, but I know you've been struggling with it for months, but it does look like it's healing, so that's great.
Yes.
So I'm gonna have you go ahead and lay down on the bed, and then we'll start the rest of the examination.
Sounds good.
Okay, Emily, I'm just going to make sure that there are no skin injuries. Go ahead and look towards me. Go ahead and look this one. Okay. I'm going to palpate your head and just rule out any abnormal masses. So we're just going to start doing a few different sensations tests.
Okay.
This first one is I'm going to be touching your face with either 1 or 2 pressure points at once, and just let me know 1 or 2. Okay.
All right. 1. 1. 2. 1. 2. 2. 2. 2. 1. 1. 1. 1. 2. 1. 2. 1. 1.
Go ahead and tell me if this feels sharp or dull.
Dull.
Okay, does this feel sharp or dull?
Dull. Sharp.
Okay.
Sharp. Sharp. Dull.
Okay. And use a slightly different tone. Just, still sharp or dull.
Sharp. Dull. Sharp. Sharp. Dull. Dull.
Okay. I'm just going to gently scrape your face. I want to make sure I don't notice any lumps below the skin. Okay. Now we're going to be testing vibration. Just let me know if you feel this.
Mm-hmm.
Let me know when the vibration stops.
Now. Stopped. Yes. Stopped. Stopped.
Okay. Okay, so I'm going to be testing either a wet or a dry sensation. And tell me if this feels wet or dry.
Oh, wet.
Okay.
Dry. 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 Wet. Wet. Dry. Wet. Wet. Dry. Dry. Dry.
Okay, that's very good. Okay, I'm going to be touching your face with these cold objects, and just let me know if it feels the same temperature on both sides of your face.
Yes. Yes.
Okay, and go ahead and tell me if this feels cold or warm.
Cool. Warm. Warm. Cool. Warm. Warm. Cool. Cool. Warm. Cool.
Okay. I'm going to be touching your face with two objects that are exactly the same. Let me know if the texture feels the same.
Yes. Yes.
Okay. Okay, I'm going to be moving on to your arm. Okay. Just double checking that there's no skin damage. Okay. Do you feel that it continues all the way throughout your arm?
I felt it more up here, not so much
Okay.
there.
Let's try that out one more time. Is it the same case? Okay. Okay. So now we're going to do the same sharp or dull test.
Sharp. Dull. Sharp. Dull. 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 Dull.
gonna do the 1 or 2 pressure points.
2, 1, 1, 2, 1, 1, 2, 1, 2.
Okay. So a few of those were missed.
Yeah, that was a little harder.
Yeah. Just gonna make a note of that. Okay, now go ahead and let me know if you feel the vibration here.
A little bit. It stopped.
Okay, great.
I could feel that. It stopped.
Okay.
It stopped.
Okay.
Stopped.
Okay, great. Okay, now I'm gonna be tapping just to make sure that there are no shooting or sharp pain as I'm tapping. If you do feel sharp needles or tingling, let me know.
Okay. A little right there.
No here.
I felt it shoot to my wrist.
Okay. Did that feel the same?
Yes. Not so much pain right there, though.
Okay.
A little bit.
It shoots down or up to your shoulder?
Shoots to my fingers.
To your fingers, okay.
A little bit there.
Those are very proportional and normal. Okay, now can you go ahead and tell me if you feel this? Okay, just go ahead and tell me where you feel it.
Around my thumb. More around my pointer finger.
Okay.
Wrist. Elbow. Bicep. Neck. Cheek.
Okay. And I'm just going to be scraping very lightly to make sure that I don't notice any lumps. Okay. So we're going to be doing your left arm. So we have a baseline to compare it to.
Okay.
Okay. Okay, go ahead and let me know if you feel sharp or dull.
Sharp, dull, sharp, 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 dull, sharp, dull, dull, sharp, sharp, sharp.
Okay, now go ahead and let me know if this feels like 1 or 2.
1, 2, 2, 2, 1, 1, 1, 2, 2, 2, 2.
Okay, so this same test you missed about 30% on your right side, and this one was completely normal. So that gives us some information.
Yeah.
Go ahead and let me know if this feels wet or dry.
Wet, dry, dry, wet, wet, dry.
Okay, I'm going to be sliding this brush. Just let me know if you feel it continuously. Okay. Go more towards the inside of the arm. Yeah, okay. Okay, go ahead and let me know if this feels the same temperature on both sides.
I felt it less on
Less on the right
side.
A little bit less or the same?
It was the same.
Okay. Okay, is this cold or warm?
Cool. 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 Warm. 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 Cool. Cool. Cool.
Okay. I'm going to be checking for perception to vibration. Go ahead and let me know if you can feel this.
Stopped.
Okay.
Yes. Stop.
Okay.
Stop.
Okay.
Stop.
Okay, great. Okay, so I don't really notice many issues besides the 1 or 2 pressure points that was visibly less accurate on your right side, and it was mostly on the lower part of the arm.
Yeah.
So right here. I am going to move on to the legs and just make sure that, that we find out if they're the same or we also notice some differences, okay?
Okay.
Okay, so I'm just going to be palpating. Don't really notice any lesions. Oh, I do notice one right the upper part of the foot. Just going to make a little mark around it. And one more over here. Okay. Okay, I notice a little bit of calluses on the bottoms of your feet. Have you noticed them for a while?
Yeah, I just got into running within the last couple months, so
Okay.
yeah, my feet have been taking a banging more recently.
How much do you run? How often and how long?
I would say maybe 3 times a month. Not a month, a week.
Okay.
For 30 minutes to an hour.
Okay. And how are your shoes have been fitted properly?
They haven't been fitted properly, but I just got a new pair of running shoes, the Brooks.
Okay.
And I've noticed that helps way more than my first pair of shoes.
Okay. So, yeah, I would definitely recommend that you go to a specialty shop if you plan on continue
Yeah.
running, and they can properly fit it and give you some recommendations for your specific type of gait, your the way that your foot is shaped and how much cushion
Yeah.
you need.
I was just reading the reviews. They said the Brooks are the best for beginners, but yeah, you're so right.
Yeah. Yeah, 'cause sometimes you might be an overpronator or underpronator instead of just like normal pronation, and it does affect the support that you need from your shoe.
Okay, got it.
Okay. I don't notice any bumps, so that's great. So we are going to be doing both legs at once to compare results a little bit easier. Can you tell me if this feels sharp or dull?
Sharp. 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 I didn't feel anything. Dull. Sharp. Sharp. I didn't feel anything.
Okay.
I still don't feel anything. Dull.
Okay.
Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp.
Okay, now we're going to be checking if you can perceive different pressure points at once. So go ahead and tell me if this feels like 1 or 2.
1, 2, 2, 1. 2, 2, 1. I couldn't tell with that one. 2, 1, 1, 1, 2, 1, 1, 2, 2, 2.
Okay, so this test was a lot better on your legs than it was on your arms. I did not really notice a difference between your perception on your right or your left leg, so that's encouraging. Go ahead and let me know if you feel the vibration.
Yes,
Let me know when it stops.
it stopped.
You don't feel it?
No, not as well.
Let's try right here.
Yeah, I can feel that. Stopped.
Okay.
I don't feel that.
No. Okay.
Yes. Stopped. Yes. Stopped.
Can you feel
Yes,
that?
I feel that, and it stopped.
Okay, so a little bit of decrease sensitivity on your right side. Okay, so I'm gonna go ahead and stroke the bottoms of your feet. This is called the Babinski reflex. Okay. And this is a little bit diminished. It could also be just because of the thickening of your skin on the soles of your feet from running. Okay. Now, can you go ahead and tell me if this feels wet or dry?
Wet. Dry. Dry. Wet. 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 Dry. Wet. Dry. 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 Wet. Wet. Dry. Dry. Dry.
So this one was also a little bit off on the right side. Okay, now go ahead and let me know if you feel this and where you feel it. You can just give me a general description if it's close to your ankle, on your ankle, or in your toes, or your foot.
My ankle. My knee. Knee. Ankle. Ankle. Toes. Feet. Foot. Foot. Shin. Shin. Ankle. Toes.
Now go ahead and let me know if this feels the same on both sides.
No, I didn't feel it as much on my right again.
Okay, gonna do the inner part of the legs.
fairly the same.
Okay, now the outer part.
Yeah, I didn't feel it too much on my right this time.
Okay. Now, let me know if this feels cold or warm.
Cool. Cool. Warm. Cool. Warm. Cool. 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 Cool.
Okay. So, we did find a little bit of diminished sensitivity on your right as well. It's not as pronounced as on your arms. I want to take a look at your spine and rule out any spinal cord injuries or vertebrae that might be pinching some nerves. Sure. So just go ahead and flip over on your belly, please. Okay, so I'm going to be opening your gown just on the back so we can expose your spine. If at any point you're uncomfortable, need a break, or you need something, please let me know.
Okay, thank you, doctor.
Okay. When you were having your hormonal acne issues, did you ever notice any acne on your back?
I did, yes, right in the middle, upper back.
Okay, I do see a few scars, but they're very minimal. And it seems to be a lot better. Okay, first I'm just palpating around the spine. As I said, I want to make sure I don't notice any inflammation. Okay. I also notice you've been getting a little bit of suntan.
Oh, yeah, I forgot about that.
Yeah.
I am probably red back.
A little bit red. Does it hurt at all?
No.
Do you wear sunscreen?
I do. It was just really killer yesterday, the sun. I was at the beach.
Okay. If your skin at any point stings or just hurts from the sunburn, let me know.
Okay.
Try to be as gentle as possible.
Yeah, I completely forgot about it, so I think we're good.
Okay.
Not painful.
Okay, I don't really notice any bumps or lumps. Okay, I'm just going to be tapping very lightly along your spine. Let me know if you feel any sharp shooting pain, any tingling, anything that feels abnormal to you.
Kind of like shot to my neck.
This one up. Okay. Did that happen again or not anymore? Okay. let me know if you feel the vibration.
Mm-hmm.
Okay, let me know when it stops.
Stop. Mm-hmm. Stop. Yes. Stop. Mm-hmm. Stopped.
Okay, great. Okay, now let me know if this feels the same on both sides. Both sides of your spine.
Yes. Mm. Yes. 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 Yes.
Okay. Now let me know if this feels sharp or dull.
Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Sharp.
Okay. Okay. Does this feel cold or warm?
Cool.
Okay, now let me know if it feels the same on both sides.
Mm-hmm.
About now.
Yes. Mm. Yes.
Okay. Cool or warm?
Cool. Or cool. 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 Warm. Warm. Cool. Warm. Cool. Cool.
Okay, Emily, so I think I'm done with those tests on your back. I'm going to take a quick look on your scalp, and then we should be done
Okay.
for today.
Great. Thank you.
Okay. Go ahead and lift your head a tiny bit. I'm just gonna. Okay. Good. Definitely notice a little bit of dandruff and flaky skin. Have you ever struggled with psoriasis or eczema?
No, never.
Never. So then it's possibly just dandruff. It could also be due to the hormonal imbalance. I don't know if you've noticed dandruff and if you have noticed it, if you started noticing it around the same time as the back. Okay, go ahead and let me know if this feels like 1 or 2 pressure points.
1, 2, 2, 2, 1.
Does this feel like sharp or dull?
Sharp.
Sharp or dull?
I didn't feel that. Dull.
Dull. Okay.
Sharp. Dull. Dull. Sharp.
Okay. Does this feel cold or warm?
Cool. Warm. Warm. Cool.
Okay, and lastly, we are going to do a vibration test. Do you feel that?
Mm-hmm. Stopped. Mm-hmm. Stopped. Yes. Stopped. Mm-hmm. Stopped.
Okay, so just gonna make note. Scalp seems to be normal. I don't notice any lack of sensitivity. And the back and spine seem normal as well. We did notice a little bit of decreased sensitivity on your legs and mostly on your arm. And this is the right arm and leg. So I am going to be ordering a few additional tests so that we can determine what's going on. But at least today we got some information about what are the symptoms and what's going on. So I'm gonna let you get dressed and I'll be right back to discuss the results and further next steps, okay?
Okay.